thank you, my colleagues, Dr. Uda Mogoli, and the president of STAR, and Dr. Christina Bista. You just saw him, STAR Vice President of Education Services, for the teamwork of planning, organizing this webinar. Dr. Goli is not able to join us today, but Dr. Bista will help us in technology. So it's my pleasure to introduce Dr. Sapkota and Dr. Hu. Dr. Sapkota is a medical epidemiologist. He works for Federal Public Health Agency. He's also Vice President of Global Health for STAR Scholar Network. He worked for World Health Organization headquarters, have been consultant of the public health to several health ministry in Europe, in Africa and Asia. He also published several books related to pandemics, which are available in Amazon. Dr. Hu is a family medicine doctor working in Indianapolis for 20 years. He graduated from Tongji Medical College in Wuhan, China. He had received PhD training in cell biology and genetics biochemistry in New Zealand and US. He had her family practice residency training in Illinois. Dr. Hu is also very active in local community volunteer service. For example, she is one of the leaders in championing to obtain personal protective equipment and donate them to hospital and frontline fighters against the COVID-19. In the next 30 minutes, you will learn from both doctors about global public health analysis on this pandemics, and Dr. Hu will teach us how we know about COVID-19 and what we can do. Okay, Dr. Sapkota, are you ready to start your presentation?
I am. Thank you, Dr. Sening. Yes. Okay, great. Hello. Yeah. Hi, everyone. Hello, world. From every part of the globe. Here in Atlanta, Georgia, it's morning, but I guess it's you are in different time zones. Across the world, and it may be afternoon somewhere, evening, and even night. So welcome, and thank you, Dr. Liu, for the introduction, Dr. Bista, and really proud of STAR Network's family. And I appreciate this opportunity to share, my experience and what I know about the pandemic, and also learn, new things as well. Because even if we are experts, we are learning. As you do as well. So I probably will not go for more in introduction. I'm a medical epidemiologist, work in WHO and several Ministry of Health. I'm a medical doctor by training, and vice president of the STAR Scholars Network for Public Health, as well as the chairperson of the Health Committee of Non-Resident Nepali Association. And I actually, while you were signing in, I was trying to, I was seeing many familiar names, such as Dr. Archana Patel from Florida and others as well. So it's kind of a small world. We're all connected here. Yeah, without further ado, I would like to go ahead and get started. Okay, so I am going to touch upon the public health part of the corona pandemic, and as of now, you have learned. You have known a lot about how the coronavirus is transmitted, how it is not transmitted, and what are the symptoms and all those. And if I repeat them, it will be boring for you. So I'm just gonna highlight on key points here, and then the things that you were wondering, and then you probably have asked questions on, and then we'll go from there. So moving to the next slide, hold on. Okay, so this is a John Hopkins map, and many of you have seen, and every day you probably go there. Even if you're not, then there are sources that where you get information from about how many number of cases, how many infection, all those, how many fatalities, and how many recovered. So as of now, as of this morning, 6 a.m. in the Eastern time, US, 3.2 million people have been confirmed to be infected in total, okay, from the start of the the outbreak all the way from Wuhan, early December up until now. Of those, 227,000 have made the unfortunate fate of being fatalities. So they're those people are dead. And moving on, this slide is actually giving you some trend. The one on the bottom left is of January 25, in the middle March 13, and then the one on the top right is current, like late April. So if you kind of examine these three scenarios, started in China. Look at bottom left. Rest of the world, they do not have infection at all. Okay, so virus started from this point, zero, in a ship. The seafood market in Wuhan. From there, look at March 3rd in the middle slide. You see infections, increasing. Spreading. Different. So over the course of 2 months, the virus actually spread out. And also, look at the top right, then you see that, the current scenario, it has actually, gone all across the countries, across the world, in 185 countries. So here, what I'm trying to, illustrate here is, there are regions in the world. If you look at the top right, South Africa, and Africa, South America, those are actually increasing. In the countries where the infections are increasing. Okay, so you see, most of them are pale in Africa, South Africa, Brazil, Chile, Bolivia, and then most of the middle of the Africa, they are not as much. Kind of a dark, the color as you see in America and in other part of the world. So what I'm trying to show is, there are regions in the world where the infection is increasing. There are regions in the world which has gone into stability. For example, in Japan, China, Australia, Italy, they actually reached to a state of the stability. They've reached to the cases rose, came to the peak, and then become plateau there. So those are the regions as can plateau. USA is still increasing, and then within a few weeks, it's going to go to plateau, and then kind of decline would occur. So as in any kind of outbreak and the viral infection. Moving on, this slide is telling you it took almost like 3 months to kind of a double from 0 to to reach to 200,000 cases, but then within a span of 15 days. It doubled, and then again within a span of 5 days, 10 days, so it is doubling, rapidly, meaning that the rate of infection, the ability of the virus to transmit from one person to other is actually is getting, in a very efficient, and it is transmitting in a very rapid manner. That's what it is trying to show here. Worldwide, 3.2 million, cases. But of those, 31% have been recovered, and then fatalities, 7% fatalities. Now, though we know 3.2 million people are infected, but current infection rate is, the number is 1.9 million, meaning that many of those who have been infected were actually have been recovered, or kind of have no longer have symptoms. Currently, who have symptoms around the world is around 2 million. So 1 million, roughly 1 million have, recovered, or, and then, unfortunately, 227 have died. Of those 2 million who are currently infected, majority of them are in mild situation, mild symptoms, okay? Not much difficult there. But though, almost 3% are, seriously, critically, affected. Those could be the ones who are in hospitals, or the ones in the ICU, or those could be the ones in the ventilators. So, 3% of the current infections, are actually, in serious condition. But again, majority, 90%, have mild, situation out there. Just wanted to point out that how many hospitals beds and ICU beds and ventilators a country or a region needs, and they are actually, depending upon what we are doing in terms of social distancing and making sure the infection does not is spread. So let's say, for example, in a country where there is no social distancing, it's very ignorant of it's just allowing people to come out in the public and doing nothing or doing very minimum. I mean, you could take, for example, in Sweden, they did that, and even in England, they were kind of kind of suggesting that. So in that situation, the infection would be affecting almost like up to 5% of the population will be infected. Okay, and those countries who have practiced social distancing in up to 8 weeks, very strict social distancing, then the infection would be around like 0.5% of the population. Meaning that if a country has a population of 1 million, then 0.5% are likely to be affected. It's a mathematical modeling. It does not happen exactly. But in a country where there are lots of social distancing, 8 weeks, then the infection rate goes down to 0.1%. And of those, whatever the scenario, whether no social distancing after 4 to 8 or more than 8 weeks, 20% of people who are infected in general are hospitalized. Okay, 20%. So those 20% are actually either going to go to ICU or get worse, or gonna get discharged or recover. Okay, and those 20% are the people who are actually, if their symptoms worsen, gonna go to ventilators, and eventually some of them would die. So as a matter of fact, in public health, we want to, again, I mean, I'm never tired of saying that, hey, prevention. So if we stop the infection, if we do a lot of social distancing and not increase the load of the new cases, so if we increase that number of people who are not infected, then we are reducing the number of load in the hospital. So in 20% are going to go to the hospital. If they are not infected, then it's much less than that, right? So that's what we're finding on. Many times I get this question, when this pandemic is going to be over, okay? So, there's probably a question on your mind as well. I want to start by saying this is not the first pandemic. As you all know, 1918, we had a big pandemic, 50 million people died. In 1968, 1958, all those happened. This is a map that was, in National Geographic. And then this showing there's 3 cities, the 4 cities, in fact, Philadelphia, San Francisco, New York, and St. Louis. And all of them in the shaded areas is showing the number of weeks of social distancing. So what it tries to show is more the social distancing, more the length, more the period of social distancing, better our chances of getting the peak and the kind of flattening the curve are there. So more, I mean, the longer the social distancing happens in a city, better it's gonna go in flattening the curve and lowering the cases. So that's what I was trying to show. Again, here up in a top row, you see cities who did social distancing, but not strictly. They started late, or or not in a very religious manner. So the number that you're seeing underneath is each of the cities. Those are the number of deaths per 100,000. Okay, so compare that to the one in the bottom row. The cities which were practicing social distancing a lot from the very beginning, and number of the deaths were the number that you see is much less than what you see on the top row. And this again from 1918. Okay, so this is the data from 1980. So again, the message here is, more the social distancing, more the prevention we do, better we are in reducing the cases, and faster we'll go out of this pandemic. Okay, again, the strategy here is prevention, prevention, prevention. Never tired of saying that. And how do we do that? And you have heard this a lot: cover your nose and mouth, distancing, washing hands with soap and water. They sound very basic and very trivial, but those are the key and golden things. That's what prevents from the people not getting infected. How do you do that? We follow 5 T's: tracing, triaging, and tracking, treating, tracing, triaging, and then tracking and treating, are the measures that we apply in doing the prevention. Contact tracing, which is you trace the people who are exposed to the infection, and you see that how they are doing, and then make sure they are not actually infected. So contact tracing is very important, and isolate and treat the infected. This is a simple schematic diagram showing how the spread of the infection occurs. You have seen this in many places. One person, infecting several persons. So the key here is, if we break the transmission of the virus by prevention, then we break, we prevent other person from getting infected, and then we lower the infection rate. Testing. There are two types of testing. One is PCR, one is immunological. PCR is a kind of rapid, happens quickly, but then but it has some drawbacks. It will take like sometimes it could be like false negative. The other test is immunological test. It actually tests the antibody on your body. So that's coming along as well. So those are the two tests I would like to kind of to tell you here. Most of the tests that you are seeing out there, if someone is infected or they want to go and test, they probably will be doing PCR test. PCR test actually identifies some viral component, and then it's gonna kind of identify and test that. Whereas immunological testing is identifying the antibody. Once you get infected, then it identifies that antibody in your body. So those are two tests. Many tests happening around the world, in a country. I've seen this. A question: when will the school open, or in a community or the country open? It depends on which country you're talking about and where places. But the key component we need to take into consideration is that before opening a school and before opening the country, the medical, the facility and medical capacity has to be sufficient in order to provide the critical care to people. I mean, as of now, there are, we are increasing in our capacity, but not sufficiently. Has to have adequate amount of protection for the healthcare workers, adequate PPEs and other supplies has to be there. And the number of infection has to either come to zero for at least 14 days, or has to be very, very low to a manageable level. Now, zero probably is not achievable and practically, but whatever number of infection that we're seeing across the in different communities and countries, that has to come down to drastically come down for people to consider reopening. Okay, so the case right now, 100,000. I mean, 1,000. I mean, per day, those new infection has to come down to 100 or even less per day, and that's when it's kind of safe to kind of assume that infection has come down. Again, the death rate has to come down, and we should be prepared for the second wave. And I'm going to come back to that later on, what second wave is. And so those are the factors we need to kind of consider reopening. The same thing for the reopening of the country. You've been hearing a lot about it in the United States, in other parts of the country. So these are the factors they take into consideration. Again, the rate of infection has to come down drastically. The rate of death has to come down, and the medical facility and the hospital has to be confident in handling the surge in the number of cases. If we have high number of cases, how are we going to handle those? So if we have enough supplies, enough medical protection, enough healthcare workers that can handle, then we are confident in opening. People has to be immunized, and also in a contact tracing, and it has to be done in a very aggressive manner. So those are the factors that you consider in reopening a country. And not every country kind of follow this, and probably in the United States they are probably wanting to kind of rush through opening, but ideally this has to happen before any country need to open. And why? Because not to kind of make people infected again. Okay, in the people who are infecting others are the people who are not showing symptoms, so they are out in the public. And again, cover, cover, cover. I'm never tired of saying this. If I go out now, my chances of getting infected is 10 times more than it was 2 months ago, because there are people out there who don't know if they're infected or no, and their mild symptoms and just kind of ignoring that. So every person outside, you assume they are infected, and that's how you're gonna protect yourself. Okay. Very little on the second wave. What is second wave? So trying to show you these two graphs of 1918. So in 1918, the first actually number. So wave is number of infection over a period of time. Okay, so in 1918, in the March of 1918, the number of infections went up, 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 and then by mid-November, it was peak and then came down, down, down. Again, in early 1919, again, the number of cases went up. So that's what they were talking about, second wave. So once we have a high peak and then kind of, when you come to the stability of zero, again, the number of infections happens again. So why does it happen? Second wave happen, many reasons. So after the first, round of, infection, many people have, kind of acquired the infection and they are immune, okay? But those who are healthy, those who are not infected, they are now susceptible for infection. So, once the curve is flattened, let's say this wave comes to stability and comes to a very minimum in end of summer. But then when the summer again comes up, so those people who are not infected, they have very high chance of getting infected by other people. And again, the influenza viruses are out there. It is kind of come down now. But then again, it's going to go up in October and May. So by fall, October and May, there could be two different viruses infecting us. One is coronavirus, and other is influenza virus. So the hospitals may not be prepared for that double burden of the infection. So that's where we're trying to kind of explain what second wave is. Okay. So last, I had actually written a few books on pandemic. They're out there in Amazon. I actually, I wrote back in 2017 and said, hey, in 2018, we're going to have this pandemic caused by influenza virus called S7N9 infection. So it's kind of a fiction, but I was trying to, I actually, mixed, the reality into fiction so that people get entertained as well as get facts information. So my second book, titled 2020, actually was supposed to come out, around the time when this infection happened. So it did not. But again, it's actually out there now. So I'm just trying to show that, there are many other books on pandemic, but I did also write some books on pandemic. So with this, I'm going to hand over to Dr. Peggy to continue. Thank you.
Thank you, Dr. Sapkota's very thoughtful analysis on global public health regarding COVID-19 pandemics. Now I'm passing the screen to Dr. Hu. Are you ready, Dr. Hu?
Yes, I do. So first, thank Dr. Liu for generous introduction. And also thanks Dr. Sapkota for a wonderful lecture. A lot of information there. So let me put my slides on. Okay. Okay, can you see the slides? Mm-hmm. Can you see that, Dr. Liu? Okay.
Yes, I do. We do.
Okay, thank you. So I'm Dr. Peggy Hugh. I'm a family doctor in Indianapolis, Indiana. Today we talk about COVID-19, what we know and do from the family doctor standpoint. As most people probably know, the first epicenter of the COVID-19 is in Wuhan, China. Wuhan is the large city located in the center of Chinese population area. Wuhan is the largest city with 11 million population. I was born, raised, and had most of my education in Wuhan. The first atypical pneumonia patient was found in Wuhan in December 2019, and which is quickly spread. In January 2020. It was reported the cause of the disease is SARS-CoV-2 virus. Wuhan was locked down on January 23rd this year, which is a Chinese New Year Eve. It's very important day we got locked down. So now what is this evil and greedy virus, COVID-19, which is an RNA virus on the center wrapped with an envelope. The envelope, the virus is still from human cells. And outside there are protein spikes. So the virus attack human cells through the outside spike glycoprotein. This through the surface of the human cells has a ACE2 receptor. The receptors are in lungs, arteries, heart, kidneys, intestines, and many other organs. So that explains the clinical manifestation. This virus is very highly infectious with R0 equal to about 2.6, means averagely one person will infect 2.6 people, highly infected. This past week, in April 21st, NIH published the first update of COVID-19 treatment guideline. The panel published this as 13 major organizations, including 2 government agencies. The guideline listed a high risk of fatal disease, although the infection can go from newborn baby up to 100 years old, but there are some factors can make high mortality rate, including age greater than 65, living in nursing home or long-term care facility, hypertension, obesity, cardiovascular disease, diabetes, chronic respiratory disease, cancer, and kidney disease. So among these, some of the factors we can modify, such as hypertension, obesity, diabetes, you can do something to control it. So that's the point from the primary care doctor. The common clinical manifestation, including when it's onset, you have a fever, chills, sore throat, headache, dizziness, loss of appetite, nausea, vomiting, diarrhea, body aching, extremely fatigue. The fatigue to the point I have patients say, I have to crawl from my bedroom to bathroom. It's very bad fatigue. And although cough and shortness breath are the hallmark of this disease, but it may not at the starting point. So if you look for this to diagnose, you may miss it. There's one very specific symptoms for this disease is loss of smell and the taste. I have some patients infected on COVID-19. They all share this manifestation. With the symptoms, with the patient recover from the disease, usually these will recover. They suddenly say, oh, I can smell, I can taste. So the incubation period is up to 14 days, and with average 4 to 5 days. That means some patients may not show any symptoms until, so in incubation time, but they are infected. The abnormal lab test with a lower white count and lymphocyte count and blood chemistry has liver enzyme elevation, C-active protein elevation, D-dimer, ferritin, and LDH. A lot of time this is associated with the severity of the disease. And the chest X-ray and the chest CT, typically they are bilateral. The radiologist will report you. The diagnosis was made by RT-PCR test for the virus. The sensitivity is about 56 to 83% with most of the tests in the United States, average 71. This means there are about 30% of false negative. So if the test is negative, you cannot completely rule out this patient of the infection. Chest CT and the chest X-ray can help for the diagnosis. So how severe the disease can be. The asymptomatic infection goes about 60 to 80%. This is the group we really have to watch out, because they look like normal people, healthy people, but they actually can infect to other people. The symptomatic infection, there are 80 to 90% are mild to moderate case, and there are 10 to 20% are severe and critical case. The death rate, the hospital goes to 8 to 28%, pretty high death rate. In all age group is 0.2 to 1.6%. However, the elderly group, when people are older than 80, the death rate is pretty high to 8 to 36%. As a reference, just as a comparison, we know every year there are a lot of people died of influenza. The death rate of influenza is about 0.1. So the death rate of COVID-19 is much higher. So Dr. Sapkota talked about we need prevention. So why do we need to prevent this? I want to emphasize this as a PCP. One is to reduce the peak of hospitalization and ICU. So when really needed, one can have better care. Another thing is you gain time for effective medication research. Yesterday, Gilead company announced phase 3 trial result. The remdesivir, the medication, reduced the time to recovery significantly, may also reduce the death rate. And you also can gain time to get a better vaccine. So good news yesterday was the Oxford team developed a vaccine expected on market in September, which is really encouraging. So now, how to prevent the infection? We need to start from the basics. Social distancing, as Dr. Sapkota emphasized, we need to have social distancing 6 feet apart. And hands wash 20 seconds with soap and water or alcohol-based hand sanitizer. And also emphasize we need to wear mask. For general public, homemade cloth mask or bandana are okay to cover mouth and the nose. For healthcare professionals, the surgical mask or N95 are needed according to their setting. Now we have to emphasize cover your nose. Recent study showed the nasal cells has a high level of ACE2 receptor, which is the entry of the virus attack. So the nasal membrane may be the place of the initial infection and the storage site of this COVID-19 virus. It can be easily, efficiently transmit to other people. So what you do, number one, you wear a mask to cover the nose. Number two, you can try my secret weapon. I often recommend my patient just for flu, allergy, or anything, a saline nasal irrigation. So now, how much a surgical mask can help you? Without the mask, there are potentially 100% transmission between the infected person and the healthy person. If the healthy person wear mask, their infection rate can reduce to 70%. If the patient wear mask, the infection rate can reduce to 5%, but if both wear masks, so the infection rate can go down further to 1.5% dramatically. This is very, very important. As we know, probably worldwide, the PPE, which is a personal protection equipment, are in shortage. So face mask used a lot is in a high shortage. Recently, there is a team in University of Chicago did a test about a homemade a mask. They find out if you use a cotton sheet, just the cotton, that can stop droplet, which block the majority. And if you add the silk or polyester layer, that can have electrostatic filtration for the aerosol. So these added together, you make your own N95 at home. So in a high population density, wearing mask is really very important. It's essential. As a primary care physician, I always tell my patient, you need to build up your own defense system. So this way, when the virus is coming, you can efficiently fight. That includes nutrition, balance the diet with good proteins, fibers, vitamins, and you may also add some herbs. And also good rest and sleep are very important. If a person has a depression or anxiety, I know a lot of people get this in this pandemic period. You need to ask for the treatment because this can reduce your immune system. According to the guideline, they have some management guideline for this disease. For asymptomatic or pre-symptomatic infection, pretty much is self-isolation, may release after 7 days of first positive test. For the mild disease, which is defined as with the symptom signs as listed above, but without shortness breath and without abnormal imaging test, those people mostly can be managed at home through telemedicine or remote visit. Like our office and even our network, we give patient a call every day to touch base, ask them. So they need a close monitor. For moderate illness, which defined as the oxygen saturation, O2 set, greater than 93%. In this patient, you need to go to hospital, you may be admitted to hospital. For severe patient, which is defined as O2 set lower than 93%, and these people will need oxygen, usually need a hospital stay. And for the critical illness, we know the patient may have really ARDS, septic shock, and a lot of problem and multiple organ failure. Those people need to go to ICU. The hospital will decide that. So now we have people ask, so what do you think, what do you see this COVID-19 pandemic? So from negative side, we all know their death, their fear, their economic crisis. Everybody see this dark side. However, we also see the positive side, which is improvement of healthcare system. Now we know what's the weakness, what we can improve. And also we go to advance in technology, telemedicine, and a wide range of people can work from home. There are also a lot of study through this period about pandemic prevention, epidemic research, and public awareness. We're also very happy to see the COVID-19 crisis united people working together. Especially Chinese American people get united. We campaign for donation of PPE to hospital, nursing home, and first responders. Our local campaign donation, through these, we get to know a lot of people we usually do not know them. They are not rich, but they put their money, they donate, they try to help healthcare people to get PPE. And when we have one doctor's family, 3 people's family, all infected by the virus seriously, and the people spontaneously get together and form a group. A lot of people in the group don't know each other probably for their life, but they gather the information, they come together, they form a group to support them. They bring their best homemade food and deliver to their door every day until they recovered. This is really a positive side we want to appreciate. So finally, Wuhan reopened on April 9th, and many states and city will open here in United States. But it is not over yet. The virus is still there, evolving, and we are still learning. But together, we will fight against COVID-19, and together, we will win. Thank you.
Thank you so much. Thank you so much for Dr. Hu and Dr. Sapkota, you using your knowledge, expertise to teach us, to educate us, and you pass your knowledge, expertise, love, and care to the public. We appreciate it. The presentation is very informative. I feel like I already know some knowledge from internet, from some media, but not very systematic and informative like this. So thank you again. There are some common questions that people might have about coronavirus. So we would love to using this panel discussion time to hear your thoughts and answers to these questions. One of the common questions is, as you mentioned, Dr. Hu, is if we wondered if a symptomatic infection transmits the virus. Is that true? If that is true, how we can deal with that in our daily life?
Yes, like this week, I have a patient, a 69-year-old grandma, came to me with all symptoms look like COVID-19. So I encouraged her to go to the test in a hospital. And yesterday I got the test result. She was positive for COVID-19. I asked her at the first encounter, I said, did you go out? This is an infectious disease. You must get from somewhere. She said, I have not been outside my house for 3 weeks. I said, who brought you things? She said, my grandson. So grandson, 24 years old, stayed with her. He works in FedEx. He claimed he's completely healthy. He can work. However, one of his colleagues was positive for COVID-19. What that means is this patient, the grandson, is asymptomatic, but he can transmit the virus to other people like his grandma. So what we can do? So in this case, if somebody closely exposed to COVID-19 patient, so you should stay away from your family member, especially seniors, because they are in high risk. So you should do the isolation if possible. If not, at least you should wear mask and protection when you deal with a family member. So Dr. Sapkota, you have some comments about this question?
No, actually, yeah, Dr. Peggy has already, covered. So, I mean, in general, I advise, any people, like even my family members, that we should assume any stranger, anyone we don't know outside to have the infection. I mean, just assume that, so that we would do all the precautions and all the measures that we take. Like we cover our nose and face, and we be at social distancing of almost 2 meters, and then don't touch face with your hands, and then wash. So asymptomatic people are the one who are spreading the virus. A, either they don't know they have symptoms. B, they know it's kind of mild, and then they're not sick enough to stay home, or they are ignoring it. So so there are people out there, and then so how to deal with it? Assume everyone outside you don't know have infection, and then take all the precautions.
Thank you so much. And also, right now many of us work remotely in this uncertain situation. Would you like to briefly share your response to this question? What are the challenges you face when working remotely? How have you adapted yourself to working remotely as a
Right.
family doctor and
Yeah. I mean, well, it's not. I mean, well, we all have worked remotely in one way or the other, in a short period, long period. But this is the longest, right? So we've never have gone through this long of remote working. So and then there are. I mean, the reason for this, everyone know, to protect us from getting infected and protect others from not spreading the virus, and then kind of help break the transmission chains and slow down the pandemic. That's the purpose of working remotely, right? But then there are some collateral disadvantages. One is you get sick of staying inside mentally, right? Mentally, and then you have so many factors that are come into play when you are working remotely. I mean, you're so used to going outside, but now you're all confined to an area, very limited outside activity. So yeah, so this is definitely a challenging, but then know that have the hope that this is actually helping yourself, your family, and everyone else. And this is going to be over. When it's going to over? So I mean, longer we practice remote, the social distancing, sooner it's gonna. I mean, we have seen examples from 1918, and adaptation. You have to kind of take into various consideration. And I know people have very sadly, gone into mental, the problems, and some have even kind of, been taking, any medications, or and some news are out there. People are committed suicide as well, attempted suicide as well. So those are very unfortunate things and tragic things. But then this is actually helping us, and then we need to adapt, and then know that this is helping, and then one day it's gonna over.
And I think this is a good thing. The remote. This is for many years. I heard about telemedicine. I think sometimes I have patients. They drove for 2 hours to see me. So sometimes I feel, oh, if I can help them reduce this driving, will be much better for them. But we can never done this. So this time, because of this virus, we have to do it. Because we cannot see because of social distancing. So this is a good thing about a remote. Of course, this also got some, we also find out some problem with this, a lot of senior patients, they don't have email address. Without email, you cannot get them in this web-based meeting. Another thing, sometimes when the patient has something like a patient say, I have pain in the ear. I cannot examine their ear from the video. Although sometimes I can see their rash. They say, I have a rash. I say, show me your rash. I can see that, or swelling, I can see. One other thing, in the office visit, sometimes when patients get better or they really sad, I tend to hug them to give them a comfort. I cannot do it with a video.
So that is challenging, but also thank you for sharing your challenge, and also we expect that we can envision and prepared for the change that the COVID-19 potentially bring to. Would you like, I don't know, Dr. Sapkota also share some like very useful information about the requirement of reopening school. So would you both want to share like how will COVID-19 change our future life, and also some information about reopening school, because many of our audience today are educators. They might be very curious about this question.
Well, as a PCP, I think we need to, at some point, we need to open school, open business, but we have to prepare. The preparation, I really highly recommend wearing mask. If they can wear mask, they have a much lower transmission rate, as we just talked on our discussion. Dr. Sapkota?
So yeah, no, thank you. That's a great question. You know, when, and then it's actually you're sharing a lot of other people the same, they have same concern. When the life gonna be back again? When are we going to go to that normal that we are having? And also like, you know, when the school's going to open, when the country going to open, these are all valid questions. So again, as I pointed out in my presentation, you know, several things need to happen, you know, before kind of opening, you know, like the community to the public. We need to decrease, we need to have the ability, the public health and medical care, everyone, and each of us has a role in it. I mean, we're all in together. It's not only one person, it's one government, you know, one society. Now, this is such a big of a, you know, gigantic, enormous, you know, tax out here for us. You know, we're all into it and we all have a part to play here. And then part is reduce the chain of the transmission of the virus. Don't let the virus go from one person to other. How we do that? You limit the virus in that person, okay? So by the person wears a mask, keeps the social distancing, you know, gets treated or go to hospitalized, and then the virus actually dies away in the person and becomes asymptomatic. And then that person, you know, then you break the transmission. So we, everything that we are doing right now, so, you know, the, you know, closure, you know, the banning and not going to community, everything is for trying to reduce the number of infection, trying to break the transmission of the virus, not letting the virus go from one person to another. That's what we are trying to do. So when the school should be open, when the number of infection has come very down, okay? So it depends. I mean, when it's going to open, we need to have confidence on, okay, the numbers has gone. I mean, if you ask me, I would like the number to go to 0. I mean, every day you are hearing new cases, right? So let the number of new cases be either 0 or very, very low, okay? Because whatever number of people are infected, those are the ones going to go to the hospital and the ICU and the ventilator. So no infections. All the hospitals has to have the capacity and the supplies and the protection of their healthcare workers for any number of people who are going to be admitted there. So adequate personal protective equipments, masks, N95 sales. You know, the doctors and nurses are no longer affected. They have the morale and the spirit to coming back to the hospital to work again for us. So all those things need to happen. The country and the community has to have the adequate testing. I mean, there were no good testing like 2 months back. We are improving on it. So again, there's still some areas where there are not enough testing. So we are in much better shape than we were in like few weeks or a month ago. So, you know, good testing would tell you whether or not you are infected. Then if you're infected, you know, kind of allow time for the infection to die away, the virus to die away on the person so that it doesn't infect others. And then the most important thing is that we need to have the confidence. Okay, if the virus comes again, then you know we're gonna manage it. So now I just want to talk about a little bit about the second wave because there was some question about it. So I'm gonna take a couple of other questions. Okay, the second wave again. What second wave is? That means it is nothing but number of infection over a period of time. So we had a peak. We have a large number of infection starting from the end of March to February to now April. So it goes up. At some point it's going to go to the peak and then go down. Okay, come down. So once it comes down, and then we go out in the public again. But then there are some people who are infected, asymptomatic, they're gonna infect other people. And then again, then we're gonna see the rise in the numbers. So that's what exactly second wave is. Once you have flattened the curve, once come down, again the curve rise up, that's second wave. Why does that happen? Because the virus is still out there. We are still not doing adequate social distancing and prevention. That also tells that those people who got the infection, mild or severe cases, they are actually immune now. Most of them have the immunity to fight against the virus. There are some cases who are, atypical, they're still infected, but majority will be immunized, okay, by their own infection. But that number is very low. And like in the US, like 1 million people are infected, right? So only 1 million have that immunity. Rest of the country do not, right? So it means we are vulnerable. Once the curve flattens down, we go out in the public, we have chance of getting infected, and then that rises the cases. That's the second wave. So to prevent that, and there was the question: when is the second wave gonna happen? That's a very good question. The answer is, ask any expert. They said we do not know for certain. Why they say that? Because this is a new virus. For every new virus, we learn. All the experts, whether it is Anthony Fauci or White House panel or whoever talks, we're all learning the new virus. Its behavior and its characteristics, though it resembles other influenza or other corona family viruses, but there are some things that are totally new after. So good question, when is the second wave gonna come? It's gonna come after the first wave comes down. And then that could be either the fall, okay, October or that could be next year. That could be in next spring. So, by all best estimate, we're thinking that next fall, which starts October to, like in the May. Why next fall? Because at the time we have influenza viruses. Now, you know that every year we get influenza. Flu, right? So it comes every year. Peaks, it starts in December, peaks in the February, goes down in May. So that is still out there in the world, whether there is corona or not. So in fall season, when there is a high amount of infection due to influenza, you also have corona. So there are two viruses working at the same time to infect us. So there will be higher chances of getting infected. So that's the time when you are thinking about, the kind of second wave happening. Again, we don't know for certain. We're just guessing by all the data and kind of stuff. So best thing again is be hopeful. This is gonna be over. Whether it was SARS, whether it was MERS, whether it was H1N1 pandemic 10 years back, all the pandemic came down, right? How we want it to come down, whether it go large number of people infected, a large number of people dying, and then it comes down, or less number of people infected and dying coming down. So we want to choose the latter. We want people to kind of less infected. So we all have the role on it. Be hopeful. It's going to go over. Apply whatever you are doing as a social distance. Don't ignore. Don't think that is over. It's not over. We still have a role to play. And there was a question about what do the school students need to do when the school open. The students need to practice all the preventive measures that they know of. A, cover nose and mouth. B, keep distance from anyone they don't know what the status is. Like teachers, students. I know it's gonna not work. That was not our normal life. We're going into PE, gymnasium, cafeteria, going out and playing, kind of being very close. That's probably have to change over a couple of years now. Slowly we're gonna get normal to that, but then until we have a good vaccine and good anything, we need to keep, even the school opens, keep social distancing. You can learn, right? You can still be friends. You can still have fun and enjoy, go to cafeteria. But if you are sitting like 2 feet in a cafeteria, now make it 6 feet. If you are in a classroom, 1 feet from other person, make it 6 feet. In a school, cafeteria, pee, all those. So that's going to happen. The last question I want to touch is mutation. Is this virus going to mutate? don't, I mean, we have to prepare for that. It's going to mutate, but then we don't know yet. I mean, the virus, I mean, the 2019, 2009 virus, it actually happened. It didn't mutate. 1918, there was very less of data that it mutated. I mean, more than likely it would not mutate, but if it mutates, then it's going to be a little bit, aggressive. It will be more virulent than the current virus. But taking chances, I mean, the answer is more than likely that it's not going to mutate, but if it mutates, then we should not be too much worried about it, because everything that we are doing right now, prevention, hospitals, that's what's going to prevent them from getting infected. Sorry, I took long, but then I think I was trying to answer all the questions here.
Thank you. Yeah, it's a good time for to have like an audience ask the question. We already see the questions. Dr. Bista, would you like to share some questions that audience ask, and so that the our panelists can answer? Thank you.
Thank you. We have many questions, and Dr. Sapkota and colleagues have been responding them via chat as well. I will take this question from Professor Pilar Mendoza. She said, a question for either of you. My family had been isolated for 3 weeks. We were very careful with the groceries, and I was covered each time. So we went to the trails and saw the passing by people. However, my 4-year-old had a fever for 3 days. How did he possibly get the virus? Or through the groceries or passing people in the trail? We are puzzled. So any ideas, any opinions would be great.
Doctor, who would you like to take that?
So I will give my perspective. The chance of infection of COVID-19, as well as other viruses, because this is a springtime, there are other viruses running around as well. So I hope this family will go with, go to trail with mask on. So this will prevent you from just pass by people, get any droplet or even airborne particle there. So this will help. Another part is the grocery. As recommended from many places, if you have the grocery not need to go to refrigeration right away, you leave it outside, just in a garage or someplace for 2 days before you move that in. And if this is something you immediately have to put in refrigerator, you have to wipe or spray with disinfectant and wipe it. And before, so you do that with a glove, and when you put that in and get everything done, you take the glove out. So do your own protection. I think that was a right way to do. If how to deal with these young kids, 4-year-old, I think you probably need to talk to your family doctor or pediatrician and try to find out.
Thank you.
Thank you. And then a couple of questions we have, actually more than a couple, about the vaccine development. They have been asking either Oxford vaccine or the US or others. Do you guys have any updates on the vaccine development?
Yeah,
I can take. Oh, yeah, I mean, yeah. So yeah, so thank you. That's a good. Yeah, that is a great question. But just want to get back to the previous question here. The child 4-year-old fever, and as Dr. Peggy said, yeah, definitely your first contact should be your primary care. Immediately, kind of know whether it is corona or not by testing and not. Take all the measures. More than, I mean, like it could be or could not be. It could be like other non-related, because if you're practicing all the prevention measures, then it could be other infection as well. But take no chances. Talk immediately. Get all the medical treatments. I mean, the sooner we go to the medical treatment, the better the chances are for getting a good recovery. First point of contact is always your primary doctor. Do not delay in contacting them, and get tested as soon as possible if you are in doubt. So that's about the vaccine. Again, I'm just trying to get back to like 12 years ago. Okay, 2009, 2005. We're talking about pre-pandemic. H5N1 influenza causing pandemic. It caused bird flu. And then people were saying, "Oh, okay, that's the virus going to cause pandemic, and then we're going to be." So they were trying to build virus. I mean, the vaccines around that. 2009 happened. It was not H5N1 influenza that caused the pandemic, but H1N1 influenza. that was a little bit milder than S5N1, but then that caused. And then when the vaccine production began in the April of 2009, it took 6 months, at least 6 months, 6 to 7 months. Okay, so we're trying to give you the perspective on that. Now there are two processes. One is egg-based vaccine production, and one is cell-based vaccine production. The typical way of producing a vaccine is inoculating the measures in an egg like chicken eggs, and then develop vaccine. And then that is a slow kind of a traditional old school style of making vaccine. Nowadays they are talking about cell-based. They didn't try in 2009. They were trying. They could. I mean, they could not. I mean, I think as of now, everyone is telling 1 year. Okay, that was told in February. So by all the estimates, it should be out either end of like this year or early next year. So that's the amount of time. Now you've been hearing trial here and trial there, and then studies there. That's good. I mean, they're all. But we need to kind of wait for like authentic, like authoritative and definitive saying, okay, the vaccines are ready. And then in a typical time, like in normal time, it does require at least a year. So that means, but then in 2009, it happened very fast, so 6 to 7 months. So it could come out like end of this year, or if not, then like early, or other. I mean, there are trials happening at several places. That's good news. But then for us to kind of see, definitely we have to hear from the government there.
Thank you. We will take one more questions. We are on the top of the hour. This question is from Professor Ratnaghosh. Says the former president of the Comparative and International Education Society. Our question is, what about developing the herd immunity? And also there is a follow-up question about the mask making mandatory for many of the government. So any of you can answer that, herd immunity.
The herd immunity is just like that I explained earlier about second wave. So how herd immunity works is, let's say if it's a new virus comes in the world, in the society, there are like 1,000 people, okay? It infects 500 people. Then the rest 500 are actually automatically, or most of them are protected, even if they are not, even if they do not get infection or not vaccinated. So that's the phenomenon for herd immunity. So if in any new disease, any viral or bacterial disease, the population is half of them or more than half of them is infected, then the rest who are not infected are protected. So that's the herd immunity. It may not work, and it may not work in the case of corona. Okay, and then there were people, there were thoughts and papers and articles out there talking about chickenpox party and then other diseases. Well, what that means is you go to a party and then you have a person is infected, get infected, and then once you get infected, you get the immunity against his antibody, and then you are protected, right? So that was the concept, and they would say, hey, why don't we try this in corona? That is very risky. That's very dangerous, because corona has so much adverse impact. It's impact lungs, it's impact heart, it's impact blood and kidney, and it's a new disease. We don't know how it's going to work. So all the other diseases, measles, chickenpox, and others, where we have seen herd immunity, it may not. I think the government is discouraging that. We shouldn't apply herd immunity here. I mean, don't go and get infected in the hope that you're going to get immunized and then you get immunity. No, I don't recommend that. I mean, don't do that, because that's not going to work. I mean, always for protection, and then always wait for the vaccines to get immunized. Second question is about mandatory about wearing masks. Again, this is society, person, like if in a community, in a family differs, right? So the government differs. I mean, not all governments have best of the science-backed practices they want. I mean, some government are very strict. Why China was so strict? Why was not US? Why was infection so high? Why did Sweden and UK let infection? People go out and get infected, and then why did kind of a Nepal, and for example, closed border. So it depends in the country and mandatory. I mean, of course, the science says mask works. Even cities, even they were saying before, okay, only the person who was infected or suspected need to wear masks, other need not. But then the recommendation came out a little bit later, say, hey, wear mask. Even if you don't have any sophisticated masks, wear something like this, okay? So this works. Any cotton piece of work, any 100% cotton, wear an autonogen first. Wear it. Why it helps is it does not let the viruses from a suspected person come to you directly on the face. Okay, so you're not B, you are not transmitting. If you are infected, you are not transmitting as much viruses out to the public. C, it actually what it does is, just want to show you here. So yeah, sorry. So hands are the major medium to transmit. So you touch the virus, you do that. So it prevents your hand touching your face. Okay. I mean, no matter how much we say don't touch your face, we're gonna touch the face. Okay. No matter. I mean, even me. So it avoids people from touching the face if you wear masks. And so before touching face, wash your hand with soap and water. I just replied one person saying that, hey, sing happy birthday song, happy birthday to you, happy birthday to you. Why sing that song while washing the hand? Because that lasts for 20 seconds. Because we all know, we need to wash hands for 20 seconds, but we don't do that. We do 7 seconds, 10 seconds. Virus, if you touch virus, it actually goes away in 5 seconds, 10 seconds, but not every virus goes away. Okay, for every virus to go away from your hand, washing thoroughly for 20 seconds, the way is singing that happy birthday song, and that's what I'm trying to say. Sorry.
That's good strategy. Dr.
I want to say just a few words about wearing mask. I have a patient, his wife is in New York, and I said, how's your wife doing? He said, well, he's doing well. He said, actually, in his opinion, also I heard a lot of Chinese doctor from New York, which is the epicenter in United States for the infection. The Chinese population in that area is much less infected than other ethnic group. It's because, I don't think it's because of the gene, but I think because they tend to wear mask. They wear mask everywhere. And if they go to the high crowded place, they also wear the eye protection, because the conjunctiva is also the place can get infected, the entrance of the virus. So this really help. Another thing is I heard from in Italy, in the high infected area, the Chinese population there has a very low incidence of infection. It's because they all wear face mask. I don't quite understand why the United government will not make this mask wearing as mandatory. And I'm very happy to hear that Costco put a policy say, no mask, no service. I'm very happy to hear that. And I know our local Chinese grocery store already imply this for no mask, no service. So I think there are more places should do this. I'm quite disappointed yesterday or the day before the news that Vice President Mike Pence, which comes out from Indiana, he went to Mayo Clinic without wearing a mask. So I think the government should really put this as mandatory.
Thank you, Dr. Hu. This is why this panel is so important, because it's educating us how to keep us and our family and the community safe. I also want to thank you, Dr. Bista, collect this question, and we have time to share that. On behalf of START Scholars Network, I would like to thank you, Dr. Sapkota, Dr. Hu, again for today's very informative presentation. Your time, expertise, and insight are very much appreciated. I also want to thank you all audience for joining us today, sharing your questions and concern with us. I'd like to acknowledge all STAR Scholars Network for providing us this international forum as an important platform to communicate with the public, reach out to educators, researchers, and professionals from different disciplines and community members. So you might have further questions. Please contact us for any questions I also want to share, our upcoming webinar series, in this Public Health and Education Transnational Society webinar series, which is the impact and implication of coronavirus on global higher education, which will be held on May 26, same time, starting from at 10 a.m. Please join us. If you have further questions, please feel free to contact us. And if you want to join our, to be our panelist to share your expertise, welcome to do that. Here is our contact information. So thank you for everyone's participation. I wish you all all best. Stay safe, stay healthy. See you next time.
Thank you.